Welcome to the Omnidental Podcast. You probably look in the mirror, notice a gap from a missing tooth, and, well, you immediately think about the aesthetics.
Right, the cosmetic side of it.
Exactly. It's a cosmetic annoyance, right?
Hmm.
A frustrating little empty space in a photograph. But today, we're going to show you how that single, unassuming empty space is actually, it's a biological tripwire.
Oh, absolutely.
It sets off a massive, largely invisible chain reaction throughout your entire body. We are talking about a cascade that impacts everything, from the structural integrity of your jaw to the health of your heart.
It really is a complete paradigm shift in how we understand oral care. I mean, we are moving far beyond that old idea of dentistry as just, feeling cavities or pulling teeth.
Yeah, the old drill and fill.
Right. The mouth is the primary gateway to your overall systemic health, and losing a tooth disrupts that entire system in ways most people honestly never see coming.
So to help us navigate exactly how this biological domino effect works, we're diving into a brilliant article penned by Dr. Bylas Poles on April 29th, 2026. It's appropriately titled, How Missing Teeth Impact Your Health.
It's a great piece.
It really is. But before we get into the heavy biology of bone loss and vascular highways, I want to briefly introduce the environment where this kind of advanced healing actually happens, because the clinic behind this article, Omnidental, is fascinating in its own right.
Yeah, it provides great context. You kind of need to understand the philosophy of a practice to understand how they approach a complex problem like systemic tooth loss.
Right. So Omnidental is anchored in Arlington Heights, Illinois, but they are serving a massive footprint across the Chicago suburbs.
A really wide area, yeah.
We are talking about comprehensive care for communities spanning Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
That is quite the reach.
Yeah. And across that entire area, the ethos Dr. Poles emphasizes is patient first. They talk about treating patients like family, aiming for highly personalized, comfortable appointments for everyone from toddlers to seniors.
And that patient-first language, it isn't just marketing copy. It translates directly into the clinical environment. Dr. Poles has over a decade of experience specifically handling complex dental injuries and emergencies.
Right.
But what really stands out in their materials is how they are redefining what it means to go to the dentist. They look at the patient holistically.
Okay, let's unpack this, because I was reading through their list of services, and I genuinely had to do a double take.
Oh, I bet.
I expected the comprehensive general dentistry, root canal therapy, extractions, deep cleanings, sleep apnea appliances. I expected the implants and the dentures.
Sure, the standard restorative stuff.
Exactly. But then I hit an entire section labeled aesthetic services.
Yep, there it is.
I'm looking at Botox, dermal fillers, microneedling, laser pigmentation removal, and permanent makeup like microblading. I even saw IV drip therapy and body sculpting.
It's quite a list.
I'll admit, I was genuinely confused. What does laser hair removal or an IV drip have to do with fixing my teeth?
It sounds totally counterintuitive if you are stuck in that traditional mindset of a dental clinic. But if you zoom out, it represents a very modern, whole-body approach to wellness and confidence.
Okay, how so?
Think about it. A smile doesn't exist in a vacuum, right? It is framed by your face. The aesthetic treatments, like Botox or microneedling, they complement the restorative dental work.
Ah, I see.
And treatments like platelet-rich fibrin or PRF, they bridge the gap beautifully. PRF uses your body's own natural healing factors, which they isolate from a small blood sample, to accelerate tissue recovery after dental surgery.
Oh, wow.
Yeah, and that IV drip therapy, that is incredibly beneficial for systemic recovery and hydration after a complex procedure.
So it's not just a random menu of spa services. It is literally treating the entire person. You fix the bite, you restore the skin, you hydrate the body.
Exactly. They are bringing physical wellness and aesthetic confidence under one roof. Plus, the practice notes they are actively environmentally conscious, using sustainable practices to minimize their footprint.
That's awesome.
It's about health on every level: the mouth, the body, and the community.
That context makes perfect sense. Now let's zoom back in from the macro to the micro. We have this holistic hub at Omnidental. Let's look at one specific, highly common issue they treat, which brings us to the core of Dr. Poles' April 2026 article, A Missing Tooth.
Yeah, what's fascinating here is the hidden mechanics of what happens beneath the gum line the very moment a tooth is lost.
Right.
We tend to think of the human jawbone as static, like we imagine it like a piece of concrete that just holds our teeth in place.
Totally.
But bone is living, highly active tissue. It is constantly regenerating, but it only regenerates when it receives physical stimulation.
Right, the text points out that natural teeth provide that crucial stimulation.
Exactly. Every single time you bite down, chew, or even just swallow, mechanical pressure travels down the root of your tooth and into the jawbone.
Okay.
That pressure signals specialized cells in the bone, called osteoblasts, to keep building and maintaining the bone density. It's a continuous feedback loop telling the jaw, hey, we are actively using this area, keep it strong.
I see.
But the moment you lose that tooth, the physical pressure stops. The signal goes completely silent.
I instantly thought of a muscle when I read that part of the deep dive.
Yeah.
Like, if you break your arm and put it in a rigid cast, you completely stop using the bicep and forearm muscles.
Oh, that's a great comparison.
Right. 6 weeks later, they cut the cast off, and your arm is visibly shriveled. The muscle atrophied because it wasn't being stimulated. You were saying the jawbone does the exact same thing.
That is the perfect analogy. The scientific term is bone resorption. Because the body is highly efficient, it doesn't want to waste energy maintaining bone that isn't doing any actual work.
It just gives up on it.
Basically, yeah. So the body literally starts to dissolve and reabsorb the jawbone in that empty space. It just melts away. And that bone loss is progressive. It gets worse the longer the space is left empty.
And as the jaw shrinks, it sets off the next mechanical domino, which is shifting teeth.
Yeah.
Dr. Pohl's article explains that the remaining teeth in your mouth actually start to move.
They absolutely do. Your teeth are designed to support one another, keeping the entire arch tightly packed and properly aligned.
It's like a tightly packed bookshelf.
Yes.
If you have a row of thick, heavy books supporting each other, and you reach in and yank a book right out of the middle, the books next to the gap don't just stand perfectly straight forever.
No, they don't.
Gravity and pressure take over. They slowly start to lean, tilt, and eventually fall right into that empty space.
And in your mouth, that tilting creates chaos. The teeth adjacent to the gap drift sideways, but it goes deeper than that. The tooth on the opposite jaw, say you lost a bottom tooth, the tooth directly above it on the top jaw no longer has anything to bite against.
Okay.
Yeah, so it can actually start to super erect. It will literally grow downward, pushing out of its socket, trying to find a surface to make contact with.
That sounds incredibly uncomfortable.
It leads to severe bite problems known as occlusal trauma. Your upper and lower teeth no longer mesh correctly. Every time you chew, you are putting unnatural, uneven strain on the remaining teeth and on the temporomandibular joint, your jaw joint.
Ouch.
It can lead to chronic headaches, jaw pain, and fractured enamel.
And if your jawbone melting and your teeth leaning over wasn't bad enough, the article brings up this terrifying concept of a hygiene trap.
It's an inevitable consequence of the shifting. When teeth lean into a gap, they sit at unnatural, overlapping angles. They create these tight, irregular crevices that your toothbrush bristles simply cannot reach, and where normal flossing becomes virtually impossible.
So it's a breeding ground.
Precisely. Plaque gets trapped in these new blind spots. If plaque isn't cleared away daily, it calcifies into tartar, which you can't brush off. That tartar harbors aggressive bacteria that attack the gum tissue, leading to periodontal disease or gum disease, and deep tooth decay.
Wow.
You lose one tooth, the neighboring teeth shift, they get infected because you can't clean them, and suddenly you are at a very high risk of losing those neighboring teeth as well.
It is a brutal downward spiral, localized right there in the mouth.
Ah.
But as we established at the start of this deep dive, this isn't just about your mouth.
Not at all.
Bone loss and crooked bites are bad enough.
Yeah.
But Dr. Pohl's article reveals the dominoes absolutely do not stop there. They crash right into the rest of your biological systems.
The mouth is the entry point for the rest of the body. When the mechanics of that entry point fail, the entire system pays the price.
Here's where it gets really interesting, because the text dives straight into nutritional deficiencies. And honestly, it makes total sense, but it's one of those things you don't realize is happening until you are already suffering from it. Difficulty chewing forces a person to change their diet.
It's often a subconscious shift, too. You find that biting into a crisp apple or chewing a lean steak or grinding up raw nuts and seeds suddenly hurts.
Or it's just exhausting.
Or it just takes way too much effort, yeah. So you start gravitating toward softer, heavily processed foods that don't require intense mechanical breakdown.
You trade the raw broccoli for mashed potatoes.
Exactly. And by doing so, you are cutting out vital fiber, essential vitamins, and complex proteins. But the nutritional deficit goes even further than what you put on your plate.
Wait, really?
Yeah, digestion literally begins in the mouth. Your teeth are supposed to grind food down into a fine paste while your salivary enzymes begin the chemical breakdown. If you are missing teeth, you swallow larger, unchewed chunks of food.
Which means the stomach has to deal with it.
The stomach and intestines have to work massive amounts of overtime, and they simply aren't as efficient at extracting vitamins and minerals from poorly chewed food.
That is wild.
So a mechanical gap in your smile quietly turns into a systemic nutritional deficiency, leaving you fatigued and weakening your immune system.
Okay, I can follow that logic easily. But the next section of the source material genuinely threw me. The article links tooth loss and untreated gum disease directly to massive, life-threatening conditions.
Yes, it does.
Specifically, heart disease and diabetes complications.
Yeah.
Now, wait, hold on. You're telling me a missing molar can trigger a heart attack? I need to push back on that because it sounds like a massive leap. How does a gap in my mouth reach my heart?
It sounds like science fiction until you look at the vascular system. Let's revisit that hygiene trap we discussed, where the missing tooth leads to severe gum disease.
Okay.
Gum disease is not just a localized sore. It is a chronic, active bacterial infection accompanied by severe inflammation, sitting right on top of heavily vascularized tissue. Your gums are absolutely packed with blood vessels.
Okay, I'm following.
Imagine holding a wet sponge that is completely saturated with harmful bacteria and you press it down directly over an open wound. What happens?
Gross. The bacteria goes right in.
That bacteria is forced right into the bloodstream. That is what happens every time you chew food on infected, bleeding gums. You are physically pushing oral bacteria into your bloodstream.
Wow, so it's literally a vascular highway from the infection in your mouth straight to the heart.
Yes. And clinical studies show that this specific oral bacteria can travel through the bloodstream and attach to fatty plaques inside the arteries of your heart.
That is terrifying.
It contributes to arterial blockages, blood clots, and significantly elevates the risk of cardiovascular disease. The mouth and the heart are biologically connected.
Unbelievable.
If we connect this to the bigger picture, the same mechanism explains the danger to diabetic patients.
Because of the inflammation.
Precisely. Chronic gum disease forces the body's immune system to remain in a constant 24/7 state of high alert. It is always fighting this low-grade infection.
Right.
This constant immune response triggers a massive release of inflammatory cytokines and spikes cortisol levels. When chronic inflammation floods the body, it actively increases the body's insulin resistance.
So the cells stop responding to insulin properly.
Exactly. The body can't process sugar efficiently anymore. For a diabetic patient, an untreated missing tooth and the resulting gum infection can make it nearly impossible to control their blood sugar levels, leading to a dangerous spiral of diabetic complications.
That completely shatters the idea of a missing tooth being a cosmetic problem.
Mm.
But the text does touch on one more ripple effect before we get to the solutions, and that is the human element, the psychological impact.
We can't ignore the mental toll. Your smile is how you interface with the world.
Right. The article points out that protecting your smile supports your willingness to laugh out loud, to engage in social interactions, to speak up in a board meeting, or to just feel like yourself.
Absolutely.
When you are hiding a gap in your teeth, you start covering your mouth. You mumble. You pull away from photographs. You hide a piece of your personality.
The psychological isolation is incredibly real, and it compounds the physical stress on the body.
Okay, so we are staring down a pretty terrifying reality. The stakes are incredibly high, physically, systemically, nutritionally, and emotionally. The dominoes are falling. So how do we stop them?
Well, there are very effective ways to intervene.
Good. I want to transition to the solutions, turning back to the advanced care offered by Dr. Poles and the team at Omni Dental.
The source material outlines two primary, highly effective clinical pathways for restoring a missing tooth and halting this chain reaction: dental bridges and dental implants.
Let's break those down. A dental bridge seems to be the more traditional route. From what I understand, it physically bridges the gap by anchoring an artificial tooth to the natural teeth on either side of the empty space.
Yes, it works exactly like its name implies. And clinically, it solves several immediate problems. By filling the gap, a bridge physically stops the remaining teeth from shifting.
Okay, so it stops the leaning bookshelf.
Exactly. It instantly stops the leaning bookshelf effect, which protects your bite alignment. It also restores your chewing surface so you can immediately improve your nutritional intake.
But the text really zeroes in on dental implants as the gold standard. They specifically highlight all-on-4 dental implants, full-arch dental implants, and even bone grafting to prepare for them. Why are implants elevated above bridges?
It all comes back to the bone. A bridge sits on top of the gums. It does nothing to replace the root of the tooth.
Ah, okay.
Therefore, it does nothing to stimulate the jawbone beneath it. The bone will still slowly resorb over time. An implant, however, is a small titanium post that is surgically placed directly into the jawbone.
Wait, how does a piece of metal act like a living lute?
Through a biological process called osseointegration, titanium is uniquely biocompatible. Your body doesn't recognize it as a foreign object to reject.
Oh, really?
Instead, the living bone cells literally grow into the microscopic grooves of the titanium post, fusing with it permanently.
Oh, so once it is fused, it restores that mechanical stimulation we talked about at the beginning.
Precisely. When you chew with a dental implant, the pressure travels down the titanium post and into the bone, signaling those osteoblast cells to stay active. It actively prevents jawbone deterioration. It is the only tooth replacement option that preserves the structural integrity of your facial skeleton.
And the article mentions all on four. That sounds like a lot of jargon. What is that exactly?
It's an absolute engineering marvel for patients missing all or most of their teeth on a single arch. Instead of needing a surgical implant for every single missing tooth, which would require massive amounts of bone and countless surgeries, a dentist places just 4 strategically angled titanium posts into the thickest parts of the jaw.
Just four.
Just 4. Those 4 strong pillars are then used to securely anchor a complete full arch prosthetic. It is highly efficient and incredibly life-changing.
Now, hearing the words surgically placed titanium post might sound intimidating. Anyone listening might feel a bit of anxiety about that kind of procedure. But OmniDental specifically highlights their advanced technology as a way to alleviate that exact fear.
The technology fundamentally changes the patient experience. We aren't talking about blind dentistry here. OmniDental utilizes advanced 3D imaging, like CBCT scanners, which creates a flawless 3-dimensional architectural map of your jawbone, your nerve pathways, and your sinus cavities.
So they know exactly what is under the surface before they even begin.
Long before. They use that 3D data to create precise surgical guides. This means the implant is placed with microscopic accuracy, ensuring they avoid nerves and utilize the strongest bone.
That's incredible.
It makes the procedure vastly more efficient, far less invasive, and significantly reduces recovery time. It is a highly conservative approach to a complex surgery.
So what does this all mean? It means you don't have to live with the pain. You don't have to accept the shifting teeth, the hidden hygiene traps, the shrinking jawbone, or the escalating risks to your heart and blood sugar. You do not have to accept a downward health spiral.
Absolutely not.
A local-friendly professional like Dr. Poles, who operates with that holistic, patient-first mentality, has the cutting-edge tools and the expertise to completely reverse this process.
It is about taking control of your health at the source. Restoring a missing tooth with an implant isn't just cosmetic dentistry. It is preventative medicine for your cardiovascular system, your metabolism, and your structural framework.
To wrap up everything we've uncovered in this deep dive, a missing tooth is a silent alarm. It is warning you of massive systemic health issues on the horizon.
Yes.
But the incredible news is that practices like OmniDental offer these highly comfortable, comprehensive ways to fix it all under one roof, right alongside advanced aesthetic care to help you recover and feel confident again.
It is whole body care, starting with the smile.
The source text leaves us with a very direct call to action. If you are in the Arlington Heights area or Buffalo Grove, Palatine, Mount Prospect, or any of those surrounding Chicago suburbs we discussed, and you are dealing with a missing tooth or tooth pain, OmniDental urges you. Don't wait. You can call them directly at 847-483-8833, or you can go online to book an appointment to start your journey back to pain-free living.
This raises an important question, one that I think completely changes how we view ourselves and our health. We are deeply conditioned by modern society to view our teeth as replaceable accessories.
We really are.
We treat them almost like fingernails or hair. If one falls out, it's just a cosmetic bummer that makes us a little self-conscious. But based on the sheer biological reality we just discussed, based on how a single missing tooth actively melts away the jawbone, taxes the immune system, limits vital nutrition, and provides a direct highway for bacteria to attack the heart, shouldn't we start thinking of our teeth as vital organs? If you lost a minor organ, you wouldn't just leave an empty space inside your body, cross your fingers, and hope for the best. You would demand immediate treatment. Your teeth deserve that exact same level of urgency and respect.
That is an incredible way to frame it, a vital organ hiding in plain sight. Thank you for joining us on this deep dive. Keep learning, keep questioning, and above all, keep smiling. Because as we now know, it is not just a cosmetic asset, it is the foundation of your health.